Welcome to you all. Good morning, good afternoon, good evening, and thank you for joining the series on our global cafes. Today, we've got a really exciting speaker, and I'm sure many of you would have already met or seen or heard of the work that Mr. Kazuki Yamada, who's the Technical Officer of Demographic Change and Healthy Aging at WHO, has been doing. Kazuki is the project manager for the UN Decade of Healthy Aging platform, the digital home for the decade. The Decade platform is designed to bring diverse stakeholders and knowledge together towards fostering silo-breaking connections, enabling different ways of doing business for healthy aging. As part of his work, Kazuki also manages a range of channels and tools integrated within the Decade platform, including digital communications and the new Decade Partnering Kit, which I'm sure we're going to hear about, which will be really beneficial for stakeholders. Kazuki has supported WH work on healthy aging since 2017, with an emphasis on digital connectivity. He holds a Bachelor of Science in Biomedical Science and an MA in Aging and Society, and hopefully by the end of this year, we will be referring to him as Dr. Kazuki, because he is completing his PhD. So without further ado, I welcome you, Kazuki, to this morning's Global Cafe.
Thank you very much for having me, Greg, and thank you to everyone who's joined us today. I'm really excited to this Global Cafe and its new format as a conversation, because the areas and topics I'm working on are all quite, not exactly nebulous, but interesting areas where a lot of perspectives and expertise can come together to really refine what our approach is within the decade, because it's something that we all build up together. So I'm really excited with this conversation. I hope for a broad conversation with everyone here, and I'm happy to be here.
Yeah,
and learn from all of you as well.
Look, and I'm sure there'll be lots of questions. I encourage people to populate the chat room with questions for Kazuki to answer, and I will moderate those as we're going through. But to start with, can you tell us a little bit about yourself that I perhaps didn't include in your bio, and tell us a little bit about the PhD that you hope to complete this year?
Sure, which is interesting because it's partially related to the work that I'm doing now with WHO. The question I'm thinking about is, where did our current understanding of the relationship between sexuality and later life come from? And part of the hypothesis is that part of the understanding comes from how scientific ways of thinking about the relationship between sexuality and aging have been constructed by scientific ways of knowing. So my PhD is looking at the development of knowledge on science of sexuality and aging from about the late 19th century to the present day, looking at how knowledge has been constructed and how scientific thought was structured and functioned in order to answer these questions. And the main thing with my thesis is creating knowledge about a specific topic or relationship begins with a question to be answered. So the way you structure certain questions changes the answer that you get. And at different points in the history of science, including gerontology, sexology, sexual science, psychology, the way our structures and societies and histories have been set up has shaped scientists' behavior in asking questions certain ways and the methods they have used to answer these questions, which is why particular ideas about sexuality and aging proliferated in certain parts of history. For example, previously, the stereotype around older people was that sexuality will grow to an extreme amount such that older age is a source of extreme sexual behaviors. This is kind of opposite to what we think now, which is that older age is an absence of sexual behavior, or that it doesn't factor into the health of older people. And so this contrast is something interesting to think about, and how our scientific investigations structure the way we ask questions to find certain answers. And so the conclusion to contemporary times is, okay, what is the socio-historical context right now we're operating in that shapes the questions that we ask, not only in the realm of science, but also in other areas of knowledge and expertise?
Thank you for that, Kazuki. Look, it's you talked about knowledge a lot. So in that opening dialogue. So let's talk about knowledge for healthy aging. What does it mean? What knowledge, evidence, and information do we draw on to inform our work that's within the sectors, within the decade and beyond?
Look, Greg, that's a really, really interesting question at the heart of obviously my PhD, but also at the work of what all of us do when we try to do work that improves the lives of older people, their families, and their communities. And this is also an area where I'd be interested in learning also from everyone here, because knowledge is kind of a difficult to grasp concept that means different things in different contexts. So I'm going to explain my take on knowledge and what I think knowledge means for the decade, and how it is so important to be thinking critically about knowledge as we do work onto the decade moving forward. But one way of thinking around knowledge is from the information sciences and knowledge management field. Some of you might be familiar with this, but there is this relationship between what we call data, what we call information, what we call knowledge. And I won't touch on it so much, but some also include wisdom in that kind of spectrum of what we consider. Data is just the result of our observation, symbols, signs, signals. If you take the example of a piece of metal, for example, the temperature of the metal is data. There's no context behind it. We're not using that fact for a particular purpose. We just know that this piece of metal is at 38 degrees, for example. The next step in that spectrum is information, which is data put into context. They're connected to each other. So who, what, when, where. So for example, this piece of metal was this temperature in this condition. In different conditions, it was a higher temperature. And when the temperature increased further, the metal melted. So that's different pieces of data connected together in context. That's information. Knowledge. Knowledge is when information is connected to each other to create a network or a framework of evaluating and incorporating and using new information. So if we, for example, say that this metal, it increases at these conditions and it melts at this condition, we can say that, the metal melts at this temperature because of thermodynamics, molecular properties, etc. And we can connect it with other types of information. For example, that we can control temperature by using a furnace, and using that to melt the metal will always melt the metal at this temperature. And principles X, Y, Z are drawing on it. So this framework of different types of information put together in a framework that each of us hold ourselves and as communities and as societies, that's what knowledge is. The interesting thing about knowledge, in contrast to information and data, is that there's an element of truth behind what we call knowledge. We're making assertion of truth when we say knowledge. So metal will melt at this temperature. When we consider that as a piece of knowledge, we're saying that this metal will always melt at this temperature and that it is true. It's an assertion of truth. There's also an interesting aspect of knowledge in that there's also a strong personal element. We always say, I know that this, or I know that this metal will melt here, or I know that when I'm in this situation, I will feel this certain way. There's a personal element to the truth that we find in this knowledge. There's also a verifiable element to what gets considered knowledge. So for example, if I'm taking the metal example, if this metal melts at this temperature, someone else should be able to track the truth of that information such that it is also true for the other person as well. So different people can track the truth and verify it, and then it becomes knowledge. You talked about evidence as well, Greg, and I think how I think about evidence is that it is the types of information that we use to combine with other pieces of information to bring information to knowledge, things that we think are true and applicable to various situations. Okay, so that's what we basically mean about knowledge. But the reason the Decade platform focuses on knowledge is because we want to diversify what we count as knowledge and diversify what we count as truth and sources of valid truth in informing policies, interventions about healthy aging. Because the framing of the decade is very much multi-sectoral and multi-stakeholder. It's not just about scientists, it's not just about the health sector. And crucially, it takes older people at the very center of all of what we do. Many older people are scientists, but not all older people are. And older people themselves, by virtue of being older people, have knowledge based on forms of evidence that they collect through, for example, lived experience, humanistic knowledge, knowledge models that come from their own cultures, for example, indigenous populations, different forms of thinking around healthy aging. And we recognize through the decade, through the plan of action, that if we are to succeed at improving the lives of older people, their families and communities, we can't rely on a single or overly rely on a single way of thinking about knowledge, because that has risks of narrowing our approach to healthy aging, that has risks of who gets counted as experts, that has risks of alienating certain groups of people to have a say on the decade, particularly many groups of older people who have historically not had a say in policies and interventions that are supposed to be meant about them. So that's why we have such a strong focus on knowledge, because it is an avenue to realize the vision of the decade and being something that is built together by everyone. So I have talked at length now, but that's basically what we're thinking about in terms of knowledge, the sources of truth and models of ways of thinking about the world that we can draw on to do certain things.
Thank you very much, Kazuki. So the platform's not just a website, but an infrastructure of digital tools and channels. Can you describe this ecosystem for knowledge exchange and how it is to celebrate progress for us?
So here, I guess I should start at the beginning, which is, okay, more concretely, how does the platform support this kind of representation of different types of knowledge, breaking silos of different types of knowledge? And we developed the platform from the beginning through massive stakeholder consultation process, through a survey of what makes knowledge platforms work, and built it together with others. And the way the platform is structured is that it tries its best to structure the availability of knowledge in a way that doesn't privilege certain disciplines or ways of thinking about knowledge. So for example, scientific knowledge could be shared on the platform in a similar way as, for example, a humanistic study on representations of aging in literature, or lived experience of aging by older people themselves, or what civil society organizations have found in their communities about experiences of aging. So we have tried to support and create a space for all these different types of knowledge to come together on the platform. When it was launched, the platform was, if you want to call it in very simplistic terms, a website, a repository where all this knowledge was being put. But now we're thinking of the platform more beyond this website, but also in terms of the digital tools and channels that are using the platform and drawing on this knowledge base to do certain things. For example, increasingly, we are drawing on what has been collected on the platform, which, by the way, now numbers over 650 individual pieces of knowledge about healthy aging. We draw on the platform to celebrate what people are doing. So for example, today is World Telecommunication and Information Society Day. So what are people doing around the world for healthy aging, for digital equity? The platform has become our source of knowledge about this, so we can truly go beyond, for example, the privileged circles of the UN's knowledge production mechanisms to really celebrate what people are doing and how people think and feel about digital equity and digital technologies for older people. This year, we are developing a progress report for the decade, a public-facing progress report for the decade, thinking through what we've achieved together, not just the UN, everyone, in these first 2 years of the decade. We've collected case studies through the platform to collate what people have done under the decade, but also the existing knowledge on the platform have been valuable sources of information for us to draw on to use that knowledge to go forward. So, Greg, your question about the platform as an infrastructure of digital tools and channels, it's not just a website, but it's a place where knowledge goes to and flows to other areas where that knowledge can be best put to use. Now, by virtue of the work that I'm doing, obviously, I speak mostly about UN processes, but the hope is that more and more stakeholders will look at the platform and all of its available channels as a mechanism for also informing your work and thinking around what we're doing together for the decade, to learn from others and to exchange. If you're doing something about digital equity or digital connectivity, lots of organizations around the world have shared what they're doing on that on the platform, and you can find all of it. And the unique value proposition of the platform is that, amongst everything else I just said about diversifying knowledge used for policies for healthy aging and implementations for healthy aging, one of the other unique value propositions is that there is no other single space that aspires to bring together as much knowledge as possible in healthy aging that is being produced by as wide of a range of stakeholders as possible across the world, and in as many languages as we can. Obviously, that's a very ambitious vision, and whether we're succeeding in fully delivering that is another question that I'm happy to talk about. But that's what we mean by the platform. It's not just being a website that people go to and see, oh, my publication is on there, but it's really part of an aspiring knowledge economy for healthy aging that we hope to use as another mechanism for connecting stakeholders to each other across silos. We don't want physicians to just be drawing on clinical studies and data all the time. This is very important, and there is a reason why, for example, randomized clinical trials are so important for many of the work we do on healthy aging. But there's also a lot to be gained from, for example, listening to the lived experience of older people, or learning more about how communities view certain medical interventions and whether, okay, it might actually work in this context, but is it feasible, or will people take it up? What do people feel about it? What is important for older people? So fully realizing this range of knowledge about healthy aging, put it together and break through sectoral barriers so that we can really deliver on the decade's vision of working together as one for what counts the most, which is the health and well-being of older people, their families and communities, future and current.
Thank you for that. I'm assuming that when you're talking about 650 additions into the website, that they've got to be moderated in terms of approval to be uploaded to the system. And I'm sure there's more than just you doing some of that work. But are there any things that sort of stood out for you, whether it be a published report or non-published reports from contributors, that you think this is a really invaluable document that needs to be on the website?
Yeah, definitely. I just want to touch on the content moderation process first, in case some are not familiar. We do have a moderation process, but it's designed to be as minimalistic as possible. So we work on minimum exclusion criteria rather than being kind of descriptive or proscriptive about what counts as knowledge, because as I just said, that is counterintuitive to the purpose of the platform. We want it to be as open as possible and anyone can contribute to the platform. So our inclusion criteria is just designed to make sure that at minimum that there is no harm that can be done by the knowledge being reproduced on the platform, that there's some fundamental basis that it is just not misinformation or disinformation. It's a careful balance to strike that requires a lot of critical thinking and being open about it, but there is that. And there's an option for anyone who uses the platform to flag an item to us if they also think that there is something problematic or something that should be looked again at a piece of knowledge that has been published on the platform. So that's what I want to say on the content management. I also want to use this opportunity to say that at the beginning, the vision of the platform has always been to have representatives of all stakeholder groups that are involved in the success of the decade to be involved in the running of the decade. I'm fully accountable in saying that we weren't able to deliver on this vision at the very beginning because it was just not feasible for us. I don't like using resource strapped as an excuse, but that is the reality. But this year, we're finally going to be able to move forward on putting together an oversight committee for the platform, which will not only look at the content of the platform, but the strategic directions of the platform based on how it has been developing so far. So please do watch this space as we look to select people and representatives who can be part of this oversight committee, which crucially will include representatives from civil society and all other aspects of sectoral groups of the platform to shape the future of the platform together. Because as impenetrable as UN political systems are, for the decade, the platform, alongside other mechanisms that we've established, like the Healthy Aging Collaborative, the platform is one concrete mechanism that we've managed to establish that represents a real opportunity for representatives of all stakeholder groups to make their work under the decade visible and to share their work with others and share them with us as well. So that's a top level view on how content works on a platform. Now, Greg, in response to your question about whether something that stood out, which was a long-winded way to get there, I just wanted to make sure that that background was clear for everyone. I mean, I was really privileged to host the space we worked together with the Prince Mahidol Award Conference in Thailand, which is a conference that runs every year. And it's a bit impenetrable, even though it's an important conference, because, you know, heads and leaders that are working on health and well-being in general gather to talk about things and make decisions. And often those conversations are important and influential, but they're a bit out of reach to the rest of the world, you might say. So we supported that process through the platform by collecting stories and voices from representatives of stakeholders and older people themselves and whoever around the world, really, because the theme of the conference at the time was, what's the world we want for the future? And isn't it was a bit strange to me that this conference would have this theme and there would be limited opportunities for the world at large to have their say on what's the world we want. So we used the platform to collect stories and perspectives on this from people around the world. And I'm always really happy when the platform is managing to amplify the voices of people, just regular people, and what healthy aging means to them. So from the perspective of lived experience, I found that a very enriching experience, but also it's just the range of work that's being, by going through the review process for the platform and managing that process together with others, it's just astonishing to, for example, the issue around digital equity has, from my perspective, started to gain prominence in the last 2 to 3 years within UN circles. And it got jump-started, obviously, with the theme of the UN International Day of Older Persons in 2021 being digital equity for older persons. But there's always people and organizations and communities who have already been doing this type of work and thinking about it for long, long before certain people have decided to think about this in more prominent settings. So for example, for digital equity, some amazing work has been done in the US by AARP and the technology services that they work with to improve digital equity and digital literacy for older people. And in other areas such as meaningful engagement, you know, other organizations like HealthPage have been working on the voices of older people for a very, very long time before these frameworks have started to be incorporated formally in UN processes. So from the perspective of the platform, it's difficult for me to choose just one. I've given some examples here because I don't want to be preferential to a certain type of knowledge over another. We want to be a bit, maintain the democracy there. But the main thing that amazes me is that whenever we decide something is important or we realize something is important, so many people have already been doing work around this that can be drawn on, and the platform makes it easier to realize that.
Thank you for that. I would ask people to actually start populating questions into the chat room, because I'm sure you have questions for Kazuki, as I do. It's interesting when you talk about how to get information onto the platform. And I think about the IFA in itself. I mean, we prepare and promote and publish a number of reports, but I don't think we actually think in the forefront that we need to be making some of these things available through the WHO Decade of Healthy Aging platform. And I think it's something that we need to be looking at. How do we encourage organizations not to think of the platform as a last resort, but as a first resort? Because I think it can generate lots of information and questions coming from wider communities about work that you are doing. So it's really important, I think, that organizations make their contributions to the decade visible through actually putting information on the website, make use of the partnering kit, And then I suppose the question is, why is it important for local organisations to be involved in the decade? And how is it going to benefit our agenda? And I think I, for one, haven't had a good look through the portal, but I will after this meeting, because I think there's probably work that's being done that can inform our own work. So what are the benefits that you see for organisations that are involved today on this discussion? How's it going to benefit their agendas, and how can they contribute to the decade?
Thanks so much, Greg. Before I respond, it's a common misconception, but I just want to encourage all of us not to think. I mean, I'm from WHO and the Secretariat is from WHO, but the decade is a UN decade of healthy aging. And even though it's called a UN decade of healthy aging and the UN are working together to drive it forward, the decade won't be a success without everyone working together on it. So please don't think of the decade, for example, as being owned or as a WHO thing or as a UN thing. It's for all of us. And we're trying our best to create mechanisms by which we can realize that kind of framing we introduce all the time. And the platform is one of them. Now, I'm always keen to not place too much privilege on the platform. Now, I'm excited about the possibilities of the platform, and it represents true things. And I know that there is a real unique value proposition behind the platform. But at minimum, I would like the platform to be an impetus to encourage, especially local organizations, to think about how their tacit knowledge, meaning knowledge that they have in their practice or as they do things or as they think about things, how the knowledge they have within themselves can be put down on paper, as in produced in a form that can be taken up by others to benefit from. Because as it stands, I think there's a lot of knowledge being produced and put together by organizations around the world that isn't reaching the people it needs to reach, even at the first step of it being available in shareable form. So this is my way of kind of starting at that first kind of epistemological, philosophical step and saying, this is not for the platform. I mean, it would be great if it's for the platform, obviously, but let this platform be an impetus to think about how what you're doing and the knowledge you're producing and the work that you do can benefit others around the world by making it available. So that's the first step. The second step is that I think in the history of aging, that this might just be my biased perspective, but there has never been more opportunities to visibly connect your work to a global agenda and commitment on healthy aging before the decade. Obviously, when the decade was declared by the UNGA, this was just political, but there are now so many mechanisms available to visibly say, I am proud of making this contribution to healthy aging. I mean, through the decade. One of those is obviously through the platform, making it visible through there. But Greg, you mentioned the partnering kit, so I'm going to explain that a little bit. Last year, we introduced a new mechanism connected to the platform and available on the platform, which is called the Decade Partnering Kit, which represents our commitment to improving the way people feel about the decade as being something that we all own together. So there's now a set of resources available on the Decade platform that can help you link your work to the decade visibly. And the most prominent example of that is a logo of the decade that is official, that any stakeholder around the world can use for free without asking for permission. You just have to agree to the terms, very minimalistic terms, to download those files and put them on your publication. What that means is obviously it puts your local work in context, because the political framework of the decade, it really indicates that it won't get anywhere if only the WHO or only the UN or only a specific group of stakeholders do work. And we want everyone to be contributing to this work to the decade, because we all have something to contribute. But it's a different story to say, okay, I'm doing this work, I know this is political framework, but no one is realizing that we want to do this for the decade and it contributes to the decade. So this visible kind of symbol of the fact that we're all working together for the decade is now available for us. And I would really like to encourage everyone to take a look to see if it's appropriate for your work and if you want to use it, and do use it, and also let us know if you do it, because then it allows us to also draw on that work and celebrate it and hold your work up as shining exemplars of what communities and organizations around the world are doing to foster healthy aging for current and future generations. And then the main theme for this year, for the decade, the past 2 years, we've been focused on collecting knowledge. Now it's time to move towards using knowledge. And I just mentioned, for example, we try to celebrate what people are contributing to the decade regularly through our communications. Whenever opportunities arise to look at what's being done for the decade, for example, within or outside the UN, we always encourage our stakeholders to look at the platform and to organizations that are branding their activities as a contribution to the decade to say, look at these, they are sources of information that you should be using as evidence to member states or other stakeholders that work is already being done within your areas, and you should look to them as examples of what we should learn from for things moving forward. So it's time to move from simply sharing the knowledge that you're doing to positioning the knowledge in ways that can be used by others. So that's, I think, what I want to say about how to make your contributions to the decade visible, sharing it with others, and you making use of the opportunity to connect your work, valuable work, to global action.
Okay, thank you for that, Kazuki. I'd be really interested to hear from any of those that are online today who've used the kit, looked at the kit, or contributed to the platform. Because I think it's important that we hear firsthand from some of those people that have been users. So please just let me know in the chat function, and I will call on people to make some comments. So please do so, because I think Kazuki would certainly value some of that feedback as well. So the IFA, other members of civil society and UN agencies work to align days of awareness and celebration, whether it be International Day of Older Persons, or, as you mentioned today, World Telecommunications and Information Society Day, where it celebrates the opportunities opened by the internet, information and communication technologies. Nowadays, we can interact, get inspired by what is happening on the other side of the planet, by our next door neighbour, or anywhere in the world. So can you tell us a little bit about your views on how this day highlights and perhaps dovetails into the reflections on the continuing conversation around digital technology and healthy aging? Because I think it's only been in the last 10 years that digital technology has been really playing a significant role in supporting the concepts of healthy aging.
Yeah, definitely. I think it's fortuitous that today is the World Telecommunication Information Society Day. Last year or a couple of years ago, the theme was digital technologies for healthy aging. The work we're doing around knowledge economy, knowledge exchange, and the platform will not be possible without digital technologies. So in that sense, it's great that I'm talking about the platform on this day about digital technologies. But as we already know from conversations that we've been having, especially during the last 2 to 3 years, there is still a digital divide that we need to look at in terms of older people and digital technologies, which is mainly, well, not mainly, but a driving factor behind that is ageism, which is really, why do we assume that older people cannot or do not want to use digital technologies? And why do we perpetuate that stereotype when that has the risk of being internalized, not just by older people, but by future older people, younger people themselves, as, when I grow older, I won't be able to use technology. If we think that, that will become a self-fulfilling prophecy that will be perpetuated going forward. So in relation to the work on the platform, this is obviously a challenging area, but we're thinking about from the most basic to a bit more involved ways of obviously being an exemplar for digital accessibility, also for older people and for everyone. And that includes working on the most technical things, like making sure that the website works for screen readers, that we include more accessibility options on the platform for various things like contrast, text size, etc., but also thinking about what is the way digital technologies can be designed and structured to facilitate the navigation of that technology easier. For example, a website in its traditional structure can be difficult to navigate. For example, if you have a different way of thinking about information. For example, if you have an attention deficit disorder, or if you have different ways of consuming information, one way of presenting information through digital technologies is not the right fit for everyone. So there is evidence behind digital platforms that shows that, for example, more conversational ways of finding information, for example, through the availability of a chatbot or recommendation mechanism to make the navigation of the technology a bit more human and more centered on what is the actual person-centered process of interacting with technology, rather than doing it in the more traditional way where you just present a bunch of links and expect people to be able to navigate through them. So there are certain things around accessibility and digital technologies that we are working on the platform as a digital technology to be able to deliver on that kind of obvious fact that digital technologies are just not accessible for everyone around the world. So that's one thing. But I think that this is also an opportunity, not just in terms of the platform, but under the decade and the global campaign to combat ageism, to really continue spotlighting the, shall we say, critical role that digital technologies will continue to play going forward. Just this past year, we've seen how artificial intelligence technologies have accelerated and are threatening many fields like education. And in the way algorithms are set up in artificial technologies and these types of new and promising technologies, there's always the risk of embedding biases, for example, in how we currently stereotype older people, or older people are not involved in the design of these technologies. So in relation to the decade, there is a global campaign to combat ageism that is being run by WHO with partners. And this is an opportunity for all of us to stay vigilant as these digital technologies develop, to make sure that we design for older people. Because the main thing I think I have, which is interesting, is that if we design for older people, we actually design for everyone. So that's what I would say.
Thank you very much for that, Kazuki. I mean, yes, designing for older people, you are designing for everyone. Your comments about the development of artificial intelligence, I think, is really important. And it's something that I think that can support older people in many ways. I know we've only just adopted some artificial intelligence in terms of having an avatar talk about our programs and services, which we've only recently came across, which actually makes it much more engaging for older people to actually see and listen to someone that's physically talking, when in actual fact it's an avatar of a person, not necessarily employed by the IFA, but a platform which can be used, and older people seem to value it. There's a couple of comments that have come in on the chat screen, and I just want to acknowledge Marie Billier in Montreal. I know she's put material on the platform. Marie, can you come forward and perhaps make some comments about that for us?
Yes, sure. Thank you very much. At the beginning, when they started the platform, there was a concern that I thought was very important. It was about languages. UN is 197 countries, if I'm okay with that, or 196, so around that. So we can imagine it's many languages, so it's not only in English. And they were really concerned, if we want to have a UN platform, that we have a diversity of languages. So they reached out to me and asked me if I could help with some French material. And I thought it was really important. And the person who was doing it was also reaching out to several countries, asking for material in different languages. What I thought for me was very important was not only to share research results, but really share tools like practice guides and things that can influence the practice all around the world, and that we could actually help each other. And I'm going to give you a very clear example. I've been working all my career in the field of elder abuse and neglect, and I did craft a practice guide regarding why older people don't ask for help. So, and really trying to understand what will hinder people from asking for help, but also what will help the people. So I thought this was some important material to share because it's with an international perspective. And I also agree that it was really important to us to be able to talk to different type of publics. So it's, and I think Kazuki has been very clear. It's not only for researchers, it's for people from NGOs, it's for groups of older person, it's for people from government that can be influenced for their policies. So for me, it's an important platform and I really appreciate having it.
Thanks for that, Marie. Kazuki, any comments?
Yeah, I just want to say, Marie, it's good to see you because obviously, we ran an initiative through the platform, which wouldn't have been possible otherwise, called the Health Aging 50, which celebrated 50 leaders from around the world who are doing amazing work on healthy aging. The platform is also advantageous for us because it's a neutral space that can be used by any organization to run a platform, to run an initiative related to the platform. For example, IFA has used the platform to do a CSO mapping on who would be interested in a CSO alliance for the decade. The Health Aging 50, celebrating 50 leaders, we were able to do this because we have this space that is framed as being owned by everyone, so that this initiative, the Health Aging 50, is also for everyone. So Marie, it's good to see you. Obviously, we were glad to celebrate your work on Health Aging 50. We have, language diversity is a really big priority for us. And we've slowed down a little bit on that front simply because we're doing our best to keep up with the demand that we get on the platform and what people submit. But we hope to see the participation of representatives on the platform oversight committee that can also represent Spanish and French, which are the two other languages we currently have.
Thanks, Kazuki. One of the contributors who's raised a couple of questions is Fatima Agam from Turkey, who's unfortunately had to leave us. But the questions that were raised was wondering if there was best practice area that promotes the age-friendly approach, because her business or their business is business for age-friendly something or other, and there's a link to that. And are there any networks? How do you build on those networks in the age-friendly arena? So how does the platform respond to one particular thematic theme like age-friendly environments?
Yeah, that's a really pertinent point because obviously age-friendly environments is one of the action areas for the UN Decade of Healthy Aging. And correspondingly, there is a section on the platform that surfaces the knowledge that is available on the platform in a different way, which is all of the knowledge that has been tagged by contributors as age-friendly environments. So there is a space that more specifically provides you with all the knowledge that has been submitted to the platform under age-friendly environments. In terms of whether there's in any way to build a network of whom we're working on age-friendly societies. From the WHO perspective, there is a global network for age-friendly cities and communities, but perhaps that's not exactly what we're thinking about because this is businesses for aging. So I'm not aware of any networks that have been shared by others on the platform that is about private businesses or other groups that are working on age-friendly. This is an opportunity to maybe bring that to a more broader audience and make us aware if there is someone working on that. But I also wanted to use this to dovetail into the second theme for the platform this year, which is to create a more organic space for interaction. Creating a community space for the platform where anyone can sign up and either join a community or request a community on specific topics or projects has been a priority for us on the platform since the beginning. But just to be transparent, obviously there were kind of funding and logistical concerns that had to be cleared. So we are re-looking at that and we've identified a solution for this, and hopefully we can deliver on that promise within this year. But if there is interest in a specific community for example, age-friendly businesses, because the platform welcomes people from all sectors, including the private sector, this could be an opportunity that you might be able to use without having to invest, for example, in your own community platform solution that brings together people. but keep track of that. I think one of my colleagues from IFA has put in the chat the public roadmap for the platform. So if you want to have a say also on how the platform develops, have a look at that. We also describe what we're doing right now, and you can make your voice heard on what you would like to see from the platform.
Thank you, Kazuki. That's very informative, and I certainly encourage people to actually make use of that function. Yamada Sharma has raised a question. Yamada, are you there?
Yes, I am.
So
Hi, everyone.
raise your question, and it's good to see you. And tell us, where are you from?
Okay, so I'm from South Africa.
Mhm.
And so I was just reflecting on these 650 moderated inputs and was just wondering whether it's predominantly from developed countries and whether there was a strategy around encouraging developing countries perhaps to engage a lot more with the platform, because I think that there is such benefit for developing countries as well. But I'm just interested to know whether what's the participation level at this point in time. Thank you.
Yeah, that's a really important point. And obviously, this is part of our framing for knowledge and the diversity of knowledge, in that there is so much knowledge being produced, for example, in developing countries or lower and middle income countries that are not necessarily looked at from a high income perspective, or kind of to facilitate knowledge exchange also between kind of lower and middle income countries to respond to that specific context. To answer this question, I'm encouraged by the fact that in comparison to maybe other initiatives that are being done by us, the proportion of representation from what might be considered, I'm always very hesitant to use these categories because they're so problematic in so many ways. But for example, low and middle income countries, the participation has been higher than we had hoped, with around 40% of the content coming from low and middle income countries and 60% of the content coming from high income countries. I think this is also something that we're working to address, because we don't want to be satisfied with that, obviously. But I think the main disparity is between English, French, and Spanish. Most of the content is actually in English, with less of a number in French and Spanish. Spanish is the second most popular language, and it's also the second most popular kind of language used for the decade as a whole. But that's where we're standing at the moment. Now, in terms of encouraging inputs from low and middle income countries or other kind of areas where historically there has been structures of or structural barriers against participation. For example, we work with our regional colleagues from the WHO perspective to help us to capture knowledge that is not necessarily being encoded or written down to be put on the platform. So we actively go and look for the knowledge that is being produced in these areas, because we know that historically there has been a lot of structural kind of barriers and structural inequities that have prevented these kind of knowledges from entering the broader mainstream kind of knowledge economy. So we put in the time and effort and pay closer attention to these areas and languages that are less represented, because we know that that will be a valuable investment, and it's the value that is just and would be equitable to invest into doing that. Now, the related question is what we do in situations where, for example, internet access is not, that prominent, or digital technology is not as common in specific areas where there would still be valuable knowledge being produced around healthy aging that we're not capturing because the platform is a digital technology. That's a thorny question. We're thinking of ways to do it either through other data collection mechanisms, but let's just say it's in progress, but it's a big priority for us.
Kazuki, thank you. And look, that's quite impressive when you consider that 40% of the inputs are coming from low and middle income countries. So that's really useful, and a useful knowledge that I think all of us can be using if we've got newsletters, marketing, information that we put out through our website, encouraging people to actually go to the UN Decade of Healthy Aging platform to make use of it and its programs. Anne Lindsay from the UN Geneva NGO Committee on Aging, I thank you for your comment. She has commented that it's a really important platform, that she hopes more people will use it. And thanks for participating today to you, Anne. As we come closer towards the end of this particular session, I would like to actually ask you, Kazuki, is there things that we as a community of NGOs, private sector, government should be doing to be able to connect better with the UN Decade of Healthy Aging platform?
I think that obviously we are probably not at the level that we would like in terms of, as you said, Greg, seeing the platform not as a last resort or the last item that should be done when thinking about sharing knowledge, but as the first place. So to start thinking about how the platform, I don't want to oversell the platform. So think about this in a way that makes most sense for your organization's workflow. But how can the platform be a part of your work, your everyday work? So, for example, we're starting to do that, not just in terms of when the WHO, so putting out my decade hat and putting on my WHO hat, when we publish something, one of the main primary dissemination mechanisms we have is obviously through the platform. And we have collected evidence that using the platform alongside our website actually increases the downloads of our resources compared to just using the WHO website alone. So that's one benefit. But thinking around, what are the value adds of the platform that can benefit you in terms of how your work is communicated to a wider audience? So that's one thing. But the second thing I really want to emphasize is usage of the knowledge of the platform, which is also what we're starting to do as WHO. How can we draw on what people are sharing on the platform to do great things with them? So in your work also, to look at the platform as a resource that they can draw on. I mean, I'm saying this multiple times as sources of good examples and best practices from around the world that are similar to what, or are beneficial to what you are doing. Because otherwise, every organization have their limited circles of what they get their knowledge and evidence from. Clinicians draw on the clinical circle of knowledge, CSOs draw on the CSO circle of knowledge, and of course the UN draw on the UN circles of knowledge. This is an opportunity to diversify how you use knowledge to inform your work. And you might find that you'll come to surprising conclusions about the projects that you're planning when you look at what's being done from around the world.
Thank you for that, Kazuki. I know I, for one, and I'm sure many of you on this call today receive many notifications or emails which include links to new publications which have been produced by whether it's the private sector, the NGO sector, academia. I suppose the question that I've never gone back to people with is, have you actually made this really invaluable report available through the UN Decade of Healthy Aging repository? Because I think that's something we could all do when we see some of these reports which we find interesting and would be of value, that we actually can go back to people and perhaps encourage them to be using the platform a little bit more to disseminate that information. As we start to wrap up, and I'm going to ask you to give some closing comments and remarks, Kazuki, but first of all, I would like to invite people to our next week's Global Cafe, where we will be in conversation with Dr. Nancy Swenger, and she'll be talking about leadership is transforming the way we provide long-term care. And I think it's going to be a really interesting conversation with Nancy, and who's with the Granger Cobb Institute for Seniors Living. It will be an interesting discussion. She will be wanting a constructive and open dialogue with everyone participating, and ask as many questions as you can of her. So please join us next week, Friday, 7 a.m. for another invaluable conversation. Kazuki, today has been really interesting, particularly for me, because I'm not sitting at the forefront of where Jane sits looking at reports that we produce, but I know that I'll be speaking to our communications team later today to look at how do we actually get much of our recent work included onto the platform, because some of the reports are really invaluable, particularly around work we're doing on NITAGs or long-term care. Some of those reports I think would be an interesting element to include on the platform. So tell us a little bit about what you think the take-home messages for us listening to you today should be.
I think the value of the decade is that more clearly than ever before, this has been a call for all of us to build something together that will transform the world to be a better place to grow older for current and future generations. Everything under the decade is for that purpose, and the decade is hoped to be something that we all build together. UN, government, member states, civil society, private sector, on and on and on. We're building this movement together to ensure that by 2030, we are responding to the promise of the Sustainable Development Goals in a way that places older people at the center. The platform is an extension of that promise. So rather than, of course, it is valuable to think of the platform as a place to hopefully get your work more visibility, attention, synergies with others. Also think about the platform as an inheritance to future generations that we're building together. There is no other place where there is an ambition to collect all of the collective knowledge we have on healthy aging work that we're doing in one place. And this is something that can be passed on also to other organizations that will start to be thinking around healthy aging, because now we're in the UN Decade of Healthy Aging. So also in terms of, informing your organization's work and also sharing your organization's work with others, also think about the platform as one concrete mechanism that is available to you to build something together that is meaningful throughout the duration of the decade in terms of what we know about healthy aging and what we're doing around healthy aging and what we think around healthy aging. So that's one thing I want to mention as well, that this is really just a tool for us to come together and work together and learn from each other to make sure that we're delivering change to the people that need it the most, which is for us older people.
Kazuki, thank you very much for that input. And I know a couple of people have only just come online because they were caught out with the 1 hour time difference. So Brendan, welcome. And I will be saying goodbye to you all very shortly. But I think it's really going to be important for all of us to think about how we can actually get content included onto the platform. And Marie, thank you for your comment, which was, tell me how I can do more around collecting French content. And I think the important thing for all of us is when you come across content which you think is a valuable resource that you can should be shared with others, whoever the authors are or the organization, you should be saying, thank you, have you considered having this document included on the UN Decade of Healthy Aging platform? So that's what my takeaway message to all of you would be, to how we can help build a legacy for future generations in terms of report and a repository and information. So thank you for today. Thank you to the IFA staff, Luana, Jasmine, and Ashni, who are invaluable. And I certainly couldn't do this job without them. So thank you very much. Kazuki, it's been fantastic listening to you. I certainly have learned a lot. And I thank you for your time, as I'm sure everyone else does. And I look forward to seeing people next Friday, 7 a.m. And I think we'll have a new moderator next Friday. Roxana from our office will be moderating next week's session. So thank you and goodbye for now.